We first developed an understanding of intrinsic subtypes from the seminal work by Chuck Peru and Teresa Sorley that was published right around 2000 and 2001. And in those studies, they defined certain subtypes of breast cancer that were based on gene expression. Luminal subtype was a subtype that is characterized by strong expression of estrogen receptor and estrogen-related genes. And so that differentiated those tumors from other tumors that really are not hormonally driven tumors. Within that subtype, then we have luminal A and luminal B, and those are still both heavily driven by estrogen genes. However, luminal B tumors have lower estrogen gene expression and have higher expression of more proliferative types of genes. So typically we think about estrogen receptor positive breast cancers as being cancers that are not dividing very quickly. They're actually very slow growing. But luminal B tumors are different. These tumors, while still having estrogen-related gene expression, are actually now dividing much more quickly due to the existence of these proliferative genes. Estrogen receptor positive breast cancers have a unique pattern of recurrence. Many of these cancers do quite well with current adjuvant endocrine therapies, but there is a percentage of patients who will have a metastatic recurrence. And the reasons for this are varied and still remain poorly understood. In some situations, this is a primary resistance to endocrine therapy. These tumors are driven by factors that have nothing to do with the anti-estrogen, and so they are resistant to the endocrine therapy. Other tumors acquire resistance to endocrine therapy, so patients will be on an anti-estrogen or tamoxifen for a period of time, and microscopic tumor cells ultimately then develop a resistance. We're still learning what those resistance mechanisms are. Some of them are related to upregulation of other pathways or mutations in the cells, such as mutation in the estrogen receptor itself, ESR1 mutations. So there's still a lot of work to be done to understand why ER-positive breast cancers recur and why they recur in some women and not others.